Welcome to the Checkup, the official blog of Lone Star Family Health Center. From interviews with staff and providers, the latest health trends, to helpful tips, and what's new, the Checkup is your go-to source for everything happening at Lone Star Family Health Center. I am your host, Courtney Galley, Marketing and Communication Manager for the Health Center. We are so excited to have Karen Hardwell, our CEO, as our first interview for the Checkup blog. Welcome, Karen.
Thank you.
Why don't you introduce yourself to everybody?
My name is Karen Harwell, and I'm the Chief Executive Officer here at the Health Center.
And how long have you been here?
I joined Lone Star back in 2012 in a financial role, and I've been the CEO since 2017.
Very good. Well, why don't you tell our audience a little bit about Lone Star Family Health Center and what we're all about?
So Lone Star has been around a little over 20 years now, and we really focus just on bringing high quality primary health care to the community. And our target kind of population are folks that really have a hard time accessing high quality health care in the typical primary care setting. So we have a lot of opportunities to offer financial discounts for those that qualify at a low income level, and we do a ton in the community, and we just have a lot of wraparound services, so we're kind of your one-stop shop, so to speak.
Yes, and we don't just do family medicine. We have a lot of different services that we provide the community.
Absolutely. So medical, dental, behavioral, pharmacy, imaging, lab, nutrition. We have a lot to offer.
Yes. And I think another thing that's very unique about Lone Star Family Health Center is we're a teaching facility.
Correct. Courtney, well done. Yes, we're a training site for recent medical school graduates that are on their way to becoming full-time family medicine professionals. So they stay with us for 3 years after medical school. They get a ton of great training here, and then they either join Lone Star full-time as a member of our permanent provider staff team, or they move on to a fulfilling career elsewhere in healthcare.
Yeah, I always kind of refer to people that it's like Grey's Anatomy because they automatically get the reference of teaching hospital.
We are a local Grey's Anatomy.
There you go.
Correct.
Right, little claim to fame, I guess.
And sorry
no.
to interrupt you, but we do that in partnership with HCA Conroe, which is the hospital next door. So a great partnership we have there.
Yeah, we're glad to have them. So this week we are launching National Health Center Week. It's a week-long initiative for all FQHCs, which is a federally qualified health center in the nation, to celebrate what we do. And so why do you think that that's important to have, especially a whole week, but why is it important to celebrate that each year?
So it's kind of our time to just kind of pause and both reflect on the great work that we do, but also try to highlight that in the community, in the media, to bring attention and just, inform and educate those around us how important we are and the impact that we make. And during National Health Center Week each year, we typically try to spend portions of that week highlighting special populations, whether it's kids or whether it's all of our patients, or it's our homeless population or migrant population. So it's just a really nice time to kind of stop, pause, and recognize the great work that we do all year long.
Yeah. And I would encourage you to follow all of our social media platforms, because we are going to be celebrating all week, and we might have some social media contest giveaways. So stay tuned to all of that, and we'll have all of our social media linked on the video for you as well too. But lastly, is there something you can tell us about what is Lone Star Family Health Center doing, looking towards the future? Maybe a year, 5 years, 10. If you had a crystal ball, what would we look like in the future?
Okay, what cat can I let out of the bag? So we just wrapped up a really large expansion project in Conroe. But what that's going to do is just kind of help us expand our central operations so that we can expand into the future and still, maintain all of our, again, central operations from our Conroe facility. So one of the new service lines that we're looking into at the moment is optometry, because we don't have a vision component to primary care currently within any of our health center sites. And then we're always also just kind of looking at the communities east of Conroe and west of Conroe, just to expand the number of sites and clinics that we have, so that we're getting close to the communities that need us. And nothing I can disclose currently, but we've got our eyes, again, kind of on the eastern side of Conroe and the western side. So those, whether it's New Caney, Montgomery, Magnolia, those are always out there.
Yeah.
And we're always making plans for expansion. So.
Yes.
Mm-hmm.
And one of the ways you'll find out about any of the latest news is to tune into the Checkup vlog. Thank you, Karen, for being our first guest.
Of course.
We hope it turns out good. And check us out for our next edition of the vlog coming up in a couple months. Thank you.